you, Marco. All right, now without any further ado, ladies, if you would please come up. I would like everyone to welcome Ashley and Anna from Mercy House. I'm very excited to be here.
While she's doing technical stuff, I'll gently get started and say, Mercy House is going to be something that we talk about that you've probably not talked about before, especially in this setting. Number one, because we're new and a new organization, but number two, because it revolves around death. Nobody really wants to talk about death. But that's what we talk about, because unfortunately, like taxes, it's the only other thing you can guarantee in life. So, but the purpose of our organization is to do death well for people who need a home for it to happen in. So with that, I'll let you do your screen turn on maybe at some point. Okay.
Screen turn on.
Laura?
Oh, just said it was already on. Now.
So then to keep going,
Yeah, a little bit about ourselves. My name is Ashley Winters. I'm the executive director of Mercy House in Chambersburg. I have been working in healthcare for 15 years in the areas of skilled nursing and rehab. That's actually how I know Tiffany back there. I'm working in this business for a while and get her back.
So I'm Dr. Anna Ken, I'm a palliative care physician. And so I do death and dying all day, which sounds awful, but it's actually great. So palliative, just to talk about the difference between palliative care and hospice, because it gets mixed up a lot. Palliative care is symptom management for people with life-threatening disease while they're still getting active treatment towards their disease. So the easiest way to think about that is a cancer patient who's still getting active chemotherapy, but may have pain or nausea, vomiting, or not going to the bathroom enough, or going to the bathroom too much, or can't sleep at night, or all those things, anxiety, depression. That's all symptoms that we can help manage. Meanwhile, kind of talking them through where they are in the process. You know, are they just getting diagnosed? Is this their fourth round? Did they just get their PET scan and they need somebody besides their oncologist who says, yeah, it looks good, to explain it to them? What does it mean for them? And what does that mean for their future? And so that's the kind of stuff palliative care does. This world in Mercy House is more in the hospice world, where it's symptom management for life-threatening disease when you're no longer getting active treatment towards your disease. So unfortunately, people think about hospice as giving up or not fighting any longer, which I hate that terminology altogether, because you didn't decide to get cancer, you didn't decide to get congestive heart failure, you didn't decide to get Alzheimer's disease. Those things happen to you. So it's not a fight that you signed up for, but it happens. And so we have to talk about that. So hospice is symptom management for life-threatening disease when you're no longer getting active treatment towards disease. And for Mercy House, you must be on hospice to be in Mercy House. And specifically, you can be on hospice. They say if you have a life expectancy of 6 months or less, but nobody has gotten, so I can't tell you for sure that you have a life expectancy of 6 months or less. But as long as you continue to show symptoms of decline during that 6 months, you can re-up for more cycles. But Mercy House is specifically for the very end of that, kind of a 30-day mark or less. So that if you're really in that kind of what we would call active dying or imminently dying stage, and you need a place for that to happen, that's an appropriate place for that to happen, like not a hospital. And maybe you can't die at home because your wife is 98 and you're 96. She might not be able to take care of you at that point. So our home is designed for the very end of life.
Yeah, we are a nonprofit organization that we developed. We got our nonprofit status last year. This whole endeavor started a little over a year ago. So actually, given the fact that it normally takes a long time to get your nonprofit status, we've been kind of plugging along and have gotten some of these things accomplished very quickly. We do have a facility, which we'll talk a little bit about, on Norland Avenue, 730 Norland Avenue, that is currently undergoing renovations. So as Anna said, we are an end of life home, and that's like the conversation killer, really. When you say people like, what do you do? You're an end of life home. It sounds bad, but really it's a really good thing. We will be licensed as a personal care home in Pennsylvania because that's our only option here for the type of service we're going to provide. Even though when you think of personal care, we're not going to be providing the traditional personal care services. Yes, we're doing your daily care. We're giving meals for those who can eat, but we're not going to be playing bingo or doing a lot of those things. We are going to be providing the personal care needs based on every individual there. And so we'll be getting our personal care license before we open. We will be serving Franklin County and surrounding counties. We are the only home in this area, will be the only home in this area that's providing this type of service. There is a home in York called Kappa's House, which is a 3-bed facility. There's a home in Harrisburg called Carolyn's House, and they are an 8-bed facility. And then if you're familiar with Doe's House in Hagerstown, they're similar to what we were doing, but they do operate a little bit differently than what we were doing. So in our area and surrounding areas, this is really it for what we're going to be specializing in. Of course, what our mission is, as Anna said again, just to provide comfort, dignity, personal end of life care to folks that are within, 30 days or less of living with us. So we are an alternative, and I'll talk a little bit about how this came about. So me being in the healthcare industry for 15 years, I've seen that side of it, working with families, working with the individuals, from when someone comes in to when they do pass. And then personally, which I think most of us, if not all of us, have experience with someone who's passed away that's been close to us. So I, have that personal experience with my mother-in-law who passed away in 2012 in a nursing facility. And more recently, 4 years ago, my grandmother, she was 93. She suffered a stroke. She was in and out of the hospital. My family and I, she lives in New York. We decided, okay, she would want to be home. We'd want to take care of her at home. So they took her home. My aunt and uncle for a week tried to take care of her at home. They tried to find caregivers to pay to come in and help with the care, and they couldn't find anybody that would do it. So within a week, she was back at the hospital. And, I was brought in on a phone call to advocate for what are we going to do next? I really had to drive home to my family. Hey, she doesn't want you taking care of her, for her, it would have been undignified. She didn't want her kids taking care of her. And 2, it was very hard for just 2 of them to take care of her. They couldn't find any help. It was exhausting. They didn't know what to do. So the only option they were left with, she couldn't stay in the hospital, obviously. She didn't have that long to live, although they couldn't say how long she had. The only option was for her to go into a nursing home. So they transferred her to a nursing home. She was there for, I would say, a week or less when I got a call from my family saying, this is not it. We do not want her here. This is not how she should spend her last days. And being that I've worked in that setting for a long time, I can tell you that there are some nursing homes that do things very well, some that do things very poorly. End of life is one thing across the board that I've never seen any place do great. Because it's not their specialty, still nursing, their focus is rehab, their focus is treatment. This is very specific to just treating symptoms while someone passes. So luckily there's a Mercy House in New York, in Endicott, where I'm from, that had a bed opening that they were able to transfer my grandmother to. So for the last 14 days of her life, she was able to spend it there with family, with people that just cared for her in this spot where she was transitioning. And from that experience, my aunt said, why aren't there more places like this? Like, this was a godsend. This was the best circumstance that you can give somebody in their family in a really bad situation. So, we had talked about it. This had kind of been a dream of mine for a long time since I started working in healthcare, to work in some sort of hospice home realm. I didn't know what that meant. My aunt said, we're going to do this someday. We're going to do this because there has to be more places like this. And someday came a year ago. They were able to kind of help financially front this effort to get it off the ground. We found a building very quickly. We purchased it. I had reached out to Kappa's House, the executive director there at the time, just to kind of pick her brain. What is this process going to be like? Because it's starting from nothing, really. And in New York, it's treated differently. It's not a personal care home. Everything's different. And she said to me, well, there is a group in Chambersburg that wants to do the same thing. Were you aware of that? And I said, no, I'm not aware of that. So she hooked me up with Anna, and Anna and I sat down. This was something that her and a group of folks were looking at doing several years before, right before COVID. And their efforts were kind of halted. And we decided, the stars aligned, and we decided to join forces. And we've been working together, the group of us, ever since to get this off the ground. So now it's finally happening. So that's kind of my story and my family's story of why we're doing what we're doing and why it makes sense to do it here, because there is nothing like this here. Want to talk a little bit about that?
Sure. So what is this actually going to be? Well, it's a home. So it's a place where people come and we provide the care for them while they're in their last days of life. So we're going to have 11 beds. It used to be the Berkshire Hathaway building. So we're currently reconstructing all that, essentially knocking down 2 real estate offices and combining that one and making it one room. So the rooms are large, they're private, they're there, there's space for your family to be with you. This is for your families. And so that's going to be there. There's going to be the ancillary things there as well, as far as the chapel, 5-space meeting room, our nurses stations, those types of things as well. So that's what we're going to see. Everybody has the private room. The why you have to be on hospice is going to provide the medical care as far as directing which medications you get and providing some of the nursing care as if the person was on hospice at your home. So if your person's on hospice at home, the nurse comes out once or twice a week. The aides come out once or twice a week for an hour or two a day, but that doesn't cover the other 23 or 22 hours a day. So that's what we're doing, is covering that other 22 hours a day. We also will have nurses at our facility and aides as well to be providing that care, but it helps to keep the cost down, not to need to provide the medical aspect. So even though I'm a physician, I will not be the physician at the facility. That way we don't have to pay one. So that worked out very well. It's designated specifically to provide fully end of life care. So a lot of us aren't necessarily afraid to die. It's that process of dying that we're scared of. So am I going to suffocate to death? Am I going to be in such terrible pain that I can't stand it? Is my family going to have to watch me? Who's going to have to be there to wipe my butt? Those types of things. You don't really want to think about them, but they really happen. And so we're going to make sure that that happens smoothly. Our staff is going to be trained. Goodness, get all the words mixed up. Trained specifically to do that type of care. So they're going to be people who aren't afraid to talk about that, who can show you some of the physical signs that the patient goes through and say, now we're seeing this. That means we're getting closer. Now we're seeing this. Some things like change in color of skin or lack of urine production. Those types of things can get us a lot closer to when this person's actually going to die. And if you have somebody trained there to tell you that, you can start to anticipate it a little more, not just like, oh, they're here, oh, they're dead. That's kind of scary. So to help, it's the patient is actually the easy part. It's the families that are the harder part, because we want to do it well for them, and they're the ones that are going to remember that. Mm-hmm. And so that's really the heart of our organization, is our guests and more so their families.
And again, the reason why we're doing this is because your options are, if you are very sick, and yes, the hospital will keep you maybe. Otherwise, they tell you, okay, here's your options. You go home, or you go to a nursing facility. Going home, okay, there's caregiver concerns. Is there enough caregiver support there? It's very, very difficult. Being a caregiver is one of the most difficult jobs there is out there. Or you can go to a nursing facility where you have staff that is trained to take care of you, but you're also taking care of 100 other people. So it's very hard to focus on the individual. I mean, not for lack of trying, of course. So really, we're kind of that in between for folks, where you don't want to send them to a nursing home. You can't take care of them at home. So here we are to provide that specialized care. Furthermore, if you go to a nursing home, if you have the funds to pay for it, great. Nursing care is expensive, right? Very, very expensive. If you don't have the funds to pay for it, then you can apply for medical assistance. That is an entire process in itself. It's a lot of work for folks. And for us, we can't accept insurances, and we will not bill Medicaid, so we don't have that process. So either you can pay privately for our care that we're going to provide, but we will not turn anybody around if they can't pay for it financially. So I think that is another thing that sets us apart. That being said, donations, fundraising, awareness is going to be a huge part of our success, because we're going to really rely to offset those costs on community support. Like to say, as Anna said, probably somewhere between 7 and 14 days, up to 30 days. Why not past 30 days? Things get a little dicey when someone stabilizes, plateaus, and it looks like they're expected to live longer. We will help with hospice's help to find an alternative location, but we're not a long-term solution, right? We're not that like a personal care home or a skilled nursing facility. It's hard on the patient. Imagine if someone stabilizes and they're alert and they're on hospice for 6 over a year and they're staying with us, but how much death they would see in that period of time, that would be challenging for them. That would be challenging for their families. So we are looking at a 30-day window or less. So we'll be screening for those kinds of things. About these. So we started renovations in January and we are expected to be done by the end of June, beginning of July, and becoming fully operational by early fall. So in that period of time, we'll be having a lot of open houses and events that you guys can come and take a look. Definitely invite anybody, everybody in the community to come see what we're about. And hopefully we'll be operational this fall. Again, we have a fundraising campaign, a capital campaign that we're in the process of really getting into now so that we can get those large donations. But ongoing donations is going to be very important. So the biggest thing that anyone can do is, talk to other people about the organization, visit our website, you can donate there if you choose to, or other people can, but just really community education and letting everybody know what we're doing is going to be very important. And that is Anna's contact information line, and then Dwayne Pittman, who is our director of advancement, who is working directly with the fundraising and gifts. So if you have any questions, you can certainly get a hold of us at any time. We'll be happy to answer any questions you have, but we're thankful that you guys allowed us to come here and tell you a little bit about our organization. Like we said, this isn't a conversation that people enjoy. It's easy for us to talk about because we're comfortable with it, but it isn't comfortable for the majority of the population, right? But it is something that we're all going to deal with if we haven't already. So, I think it's important that there is a space in our community for people to be able to go and feel comfortable and that they're going to be cared for very well at the end of life. So, yeah.
Yeah, do you have business cards to pass out or something that we can pass on to?
I do. Yep. Yep,
Okay.
I do have a little bit of information. I have something about the informational packets here that I can leave. So if anybody wants to take one, tells a little bit more about the organization, but you can always visit our website that gives you a slew of information.
Will you get referrals from current nursing homes or like Tiffany, if you have a patient who is really in need of that,
Yeah, I can see our referral base being the hospital certainly be a big referral base, but also personal care homes, skilled nursing facilities, home care.
Hospice patients who are at home,
Yeah.
but are in a caregiver crisis or really got to that point where they can't be cared for at home any longer, will be another major referral.
So we really are partnering with a lot of hospice agencies in this area. There's a lot of options for folks. So we'll be partnering with all of them and all the nursing facilities. If they for whatever reason cannot keep the person where they are, I'm sure we'll get referrals from them as well.
Do you have a budget for a yearly budget and calculations?
Yes, off the top of your head.
So we're looking to raise at this point about $1.4 million. Sounds like a lot of money. It is a lot of money. But we have already making huge steps toward that goal. The really great thing is that our building was purchased and it cost over $1 million and it was donated to us. So we don't have that cost that we have a mortgage on or anything like that. And we do have operational costs that are covered up to a point. So we're not starting from absolutely zero. We do have operational costs, but it is, ongoing. We're going to need to continue to raise a lot of money.
So you know what your operational costs are going to be, for example, for a year.
For a year, I
Don't remember the number.
I don't
but
remember
we
the
do have
number.
it calculated.
if Ben,
Ben Lefevre, he's a Rotary.
Yes.
He's the.
Yeah. He serves on our board. He's
Yes.
our finance chair. So
If people know that.
yeah.
Sorry.
Any other questions?
Great.
Work you do is absolutely impressive.